Welcome back to the channel. Today, supported by GHC Hospital Health Promotion Initiatives, this is Dr. Alfred Egedovo. We're diving into a topic that's crucial, yet often shrouded in mystery and misconceptions: contraceptives. In today's modern society, family planning and contraception play a crucial role in helping individuals and couples make informed decisions their reproductive health. With a wide range of contraceptive methods available, it can be overwhelming to navigate the options and determine which one is best suited for your needs. In this blog post, we will explore the benefits of various contraceptives as well as long-term impact on health. Now, when you hear the word contraceptive, what comes to mind? For many, it's the pill, condoms, or maybe even IUDs. But did you know there are over 15 different types of contraceptives out there, each with its own pros and cons? One of the most popular and effective contraceptive methods is the birth control pill. This oral contraceptive contains hormones that prevent ovulation and thicken cervical mucus, making it difficult for sperm to reach the egg. The pill is highly effective when taken correctly, with a failure rate of less than 1% in typical use. In addition to preventing pregnancy, the pill can also regulate menstrual cycles, reduce menstrual cramps, and clear up acne. However, some women may experience side effects such as nausea, weight gain, and mood changes. It is important to discuss any concerns with your healthcare provider to find a pill that works best for you. Let's start with the basics. The most common question is, how do contraceptives actually work? Well, they prevent pregnancy primarily by stopping ovulation, thickening cervical mucus, or even altering the uterine lining. But here's a thought. What happens when we don't talk about these methods openly? Are we missing out on empowering individuals to make informed choices? Another commonly used contraceptive method is the condom. Condoms are a barrier method of contraception that can prevent both pregnancy and sexually transmitted infections. They are easy to use, widely available, and have no hormonal side effects. However, condoms are not as effective as hormonal methods, with a failure rate of around 13% in typical use. It is important to use condoms consistently and correctly to maximize their effectiveness. Now let's address a controversial trend: the rise of natural contraceptive methods. With apps tracking cycles and the pull-out method gaining popularity, some argue that these methods are just as effective as traditional ones. But are they really? Studies show that natural methods can have higher failure rates. So, is it worth the risk? Intrauterine devices, IUDs, are another popular contraceptive option that can provide long-term protection against pregnancy. IUDs are small, T-shaped devices that are inserted into the uterus by a healthcare provider. They can stay in place for several years, depending on the type of IUD. There are two main types of IUDs: hormonal and non-hormonal. Hormonal IUDs release progestin, which thickens cervical mucus and prevents sperm from reaching the egg. Non-hormonal IUDs release copper, which is toxic to sperm and prevents fertilization. IUDs are over 99% effective in preventing pregnancy and have the added benefit of being reversible. Once removed, fertility returns quickly. However, some women may experience side effects such as cramping, spotting, and changes in menstrual bleeding patterns. And what about the stigma surrounding contraceptive use? In many cultures, discussing birth control is taboo. Why is that? Shouldn't we be having these conversations to help educate and reduce misinformation? While there are many benefits to using contraceptives, it is important to also consider the drawbacks and potential risks. Some contraceptive methods may not be suitable for everyone, and it is important to discuss your options with a healthcare provider to find the method that is right for you. Additionally, contraceptives do not provide protection against sexually transmitted infections, so it is important to use condoms in addition to other forms of birth control if you are at risk. Another burning question: what about the environmental impact of contraceptives? With the rise of sustainable living, some people are questioning the ecological footprint of hormonal contraceptives. Could we see a shift towards more eco-friendly options in the future? So, what do you think? Are you team traditional contraceptives, or do you lean towards the natural method? Let's get a conversation going in the comments below. In conclusion, family planning and contraception are essential components of reproductive health, allowing individuals and couples to make informed decisions about their fertility. By understanding the benefits and drawbacks of various contraceptive methods, you can choose the option that best suits your needs and lifestyle. It is important to consult with a healthcare provider to discuss your options and address any concerns you may have. Ultimately, the goal of contraception is to empower individuals to take control of their reproductive health and make choices that align with their goals and values. And remember, whether you're considering contraceptives for the first time or just want to learn more, knowledge is power. Don't forget to like, subscribe, and hit that notification bell for more discussions on topics that matter. Until next time, stay informed and empowered. Visit our website, www.ghhospital.com,